welcome to the program Health Matters on your favorite TV station, NTA Gombe, Jewel of Excellence. I am Shade Salau, and today our topic will be on stroke. And I'm being joined by my guest in the studio in the person of Dr. Kanu Alfred. He's a consultant neurologist, Federal Teaching Hospital, Gombe. Doctor, you're welcome to the program.
Thank you for having me.
When we say stroke, medically, what does it mean?
Okay, medically, stroke simply means a focal neurologic deficit that is attributable to a vascular cause. And to bring it home, stroke is the sudden development of signs or symptoms that result from a disorder of the vessels within the brain, either blockage of those vessels or rupture of the vessels within the brain.
Thank you, doctor. Talking about signs and symptoms, what can one say this is a sign or this is a symptom of stroke?
Thank you. Stroke has numerous signs and symptoms, but the signs or the symptoms the individual or the patient presents with is actually dependent on the part of the brain that is affected by the stroke. But very commonly, symptoms stroke patients present with can be summarized using the acronym FAST. F being for weakness of one half of the face, A is for arm weakness, S is for speech difficulty. The T is actually to emphasize the fact that time is neuron, meaning time should not be wasted. Such a patient should seek medical attention.
Okay. When we talk about stroke, what are the types? Because I know there are instances where someone will say one has a stroke of the face, one has speech difficulty. So what types of strokes?
Okay. Broadly speaking, strokes are categorized into two, depending on the kind of affectation or injury the vessel has. We have two forms: ischemic strokes and hemorrhagic strokes. Ischemic strokes are strokes resulting from blockage of blood flow through any vessel within the brain, while hemorrhagic stroke are strokes that result from rupture and bleed into the substance of the brain.
Can one even have stroke and not even realize it?
Yes, it's possible, and these are the categories of stroke we tag silent strokes. As I said earlier, the different parts of the brain actually subserve different functions. So if the part affected doesn't really concern obvious things like movement, speech, etc., if the part affected is not something that is obvious, the stroke will happen without the individual knowing it. In such a case, we say the person has had a silent stroke.
When you talk about silent stroke, does it also mean like mini stroke in a way that someone can have it and then fully get recovered?
Well, I don't want to call it mini stroke in the sense that a mini stroke may simply mean having a disturbance of function that is not too severe and doesn't interrupt the patient's activity of daily living significantly. For instance, somebody just having mild heaviness of one arm, the person can lift the hand to a reasonable extent, walk freely, speak freely. That may pass for a mini stroke. But silent strokes actually are strokes that you don't even know completely that they occurred until a scan of the brain is done, and we now find locations that have been affected previously without the patient knowing.
Okay. Doctor, thank you so much for this insight. Do children also suffer stroke, or is it just the adults and the aged?
Well, from what I have said, stroke could affect any age, even though it's more in middle-aged and older individuals, but stroke could occur in any age. And the reason is because several factors could account for stroke, not just the common ones people know. For instance, a sickle cell anemic child, could develop a stroke in childhood. Thank you.
Doctor, how big of a role does family history play in stroke?
Yes, family history is quite important in stroke. Um, the one I just finished talking about, for instance, individuals with sickle cell disease could come down with stroke, and you knowing their genotype alone, you know they are at risk of stroke based on just your knowledge of their genotype. And there are genetic conditions actually that have been associated with the development of stroke. There are numerous of them, even though in our environment they do not play a very big role as conditions like hypertension, high cholesterol, diabetes, and other risk factors play, but they are recognized genetic causes of stroke.
Okay, you just mentioned some of the risk factors. In fact, I was about asking you, but then with the underlying risk factors like hypertension, diabetes that you just mentioned, does eating habits and social lifestyle also contribute? Maybe like going to the gym, avoid alcohol consumption. Like, does it also play a role?
Yes, they play a very important role. And with the increase in the incidence of stroke we are seeing in recent times, one cannot overemphasize the role of preventive measures. And these measures include things that are aimed at weight reduction via dieting or regular exercise, avoiding of sedentary lifestyle, avoiding of saturated fats, cutting down on alcohol consumption. They play a very immense role in reducing the risk factor for stroke.
Thank you so much for this insight. We noticed that stroke is common, just as you've said. So what could be the reason? Is it because times are hard these days, or does it have to also do with depression? What is really going on now?
Well, this is multifactorial. Studies have shown that in recent decades, stroke incidence has actually increased in Africa, especially the low and middle income countries. It's rising, and studies have attributed it to the changing habits and lifestyle. We are getting westernized in our diet. We are getting more and more sedentary. Some have also spoken about the role of air pollution, indoor and outdoor air pollution. You have industrialization is increasing, and then some have also talked about the fact that the aging population, if you have more of the aged around, the risk of some of these or the prevalence of conditions like stroke and other non-communicable diseases will also has also been observed to be rising.
Talking about industrialization, so if you were in the position of government to give an advice, what will you say concerning industrialization that you just mentioned now?
Well, we are all in favor of things that will make life easy for people. So industrialization is actually a welcome development. However, certain things are supposed to be controlled, and that is why people are talking about factors that influence climate change, greenhouse emissions, and all that. So I wouldn't say regions should stop their drive for getting industrialized. However, harmful practices should be looked into and controlled to forestall the rising incidence of stroke.
Okay, thank you so much, doctor. There are cases where one suffers stroke and somehow comes out of it. Now, the question I want to ask is, can stroke be cured permanently?
Thank you for that question. It's a question that has two answers. Stroke, we rather prefer using the term can be treated.
Okay.
The issue of cure doesn't come in here very clearly. Let me explain. In individuals that suffered a stroke resulting from blockage of a particular blood vessel to the brain, for instance, those that are privileged to come or present to the hospital early, particularly facilities where a drug can be given after doing brain scan to dissolve the clots that occluded the blood vessel. Such a condition, the symptoms can be reversed.
Okay.
So we wouldn't call that cure, but we'll call it that it was reversed. But this scenario I painted, unfortunately, is not very common in our environment because the patient has to get to the hospital very early, within 3 to 4.5 hours, and then most hospitals don't have facility for this kind of intervention. So what we say is stroke, largely speaking, is treatable, but we don't use the term cure. And the treatment to a reasonable extent is to prevent complications arising from the stroke that has happened, and also to institute preventive measures to against future strokes, because the fact that an individual has suffered a stroke now doesn't mean he is not at risk of having another stroke. So what we emphasize is actually treatment for the stroke that has occurred and rehabilitation. To a reasonable extent, people get recovery. So I prefer the term recovery than cure. So
Okay.
recovery is feasible in a good number of instances than saying cure.
Cure. Okay. Thank you, doctor. Among the underlying illnesses that result to stroke, it's as if hypertension takes, let's say, precedence, because it's like the number one factor. You hear people, like generally, you hear people say, this person has a BP of maybe 180, 200. Before you know, the person goes down with stroke. So is it that BP, high blood pressure, has a great level of one getting stroke?
Thank you very much. I have actually longed for this question. High blood pressure, known as hypertension, is the most important risk factor for stroke globally, not just in Africa. It is the most important risk factor. And since it is regarded as the most important risk factor, it means if individuals do take measures to check their blood pressures regularly and ensure it is being controlled with medications, then the incidence of stroke will reduce drastically. So it is one risk factor that if it is looked into, the incidence of stroke will fall drastically. And hypertension largely is asymptomatic in the sense that you feel nothing while having a high blood pressure. So most times people start feeling symptoms when a damage is already occurring. And hypertension actually could affect several organs of the body, ranging from the brain causing stroke, the heart causing heart attack or heart failure, the kidneys causing kidney failure, the peripheral blood vessels causing what we call peripheral arterial disease, and is something that can be controlled and can lead to significant lowering in the number of stroke cases we have.
Thank you so much, doctor. How about low blood pressure? Does it also result to stroke or just high blood pressure?
Thank you for the question. Blood pressure is supposed to be controlled within a normal range, meaning a high one is not desired and a low blood pressure is also not desired. In a situation where blood pressure starts falling, the body tries to compensate and still allow sufficient blood flow to vital organs like the brain and the heart. However, when it falls to a critically low level, below a critical limit, those organs also suffer. So low blood pressure can actually cause a stroke.
Wow. Doctor, what can one do? What advice will you have for people that have high blood pressure or low blood pressure? Because honestly, this is a very common scenario we get to find ourselves. You know, when someone is either down with high blood pressure or low blood pressure resulting to stroke.
Well, let me begin with high blood pressure. High blood pressure is something that can be controlled with medications. Can be regularly measured in a hospital or a clinic or a health center, and the patient is given medications and followed up without much issues. And patients that are well controlled can live normal lives feeling nothing. The only challenge we have usually getting patients to take their medications is because they feel nothing. The blood pressure is high, but they feel nothing. And most people don't feel motivated to keep swallowing pills when they are feeling nothing. But the danger of ignoring the medications is one could come down with sudden complications like a stroke, for instance. For low blood pressure occurring without incidences of people taking overdosage of BP medications or following certain illnesses, honestly, it is not common. And any person suspecting he has a low blood pressure, either he's feeling dizzy or lightheaded, should present to the hospital for proper checkup.
Thank you so much, doctor. Taking Gombe as our focal point, how will you rate the level of awareness of stroke among patients, or in the case of your job, your experience so far?
Well, from my experience, the level of awareness of stroke in terms of knowing that a stroke has occurred is quite high. But the level of awareness in managing and preventing stroke is very low.
Okay.
People are not bothered about regular health checks, blood pressure, blood glucose checking their blood lipid level. People are not too bothered about that. People are not concerned about their weight, being overweight and being obese. People are not bothered about that. You hardly see people walking out or doing a brisk walk, for instance. It's not very common. You see a few by the roadside, but most people don't feel that is important, but it's really important. So as long as Gombe, as far as I know regarding Gombe, recognition of signs and symptoms of stroke is quite common because they usually rush the patient to the hospital when the stroke has occurred. But recognition of risk factors, especially the ones that you can modify or do something about, the knowledge level is quite low.
What will you say is an attribute to this, having low knowledge about stroke? What do you think is the cause?
Well, it's multifactorial because at times, let me give an instance with somebody having a little fault in the car. As long as you don't seek to reach out to a mechanic, you are not likely to know what the problem is. So when people feel they need to fall ill before going for health checks, that in itself is a challenge. But I'm happy this kind of forum where media outlets carve out time to enlighten the public. So this will go a long way. Even this present meeting we are having will go a long way in enlightening the public regarding the risk factors and the dangers of having a stroke.
Doctor, lastly, what would be your advice to our esteemed viewers who are watching concerning stroke?
My advice to our esteemed viewers is for individuals that are already adults, especially those that are above the age of 30, go for a health check. Check your BP, get your blood sugar checked, and then eat a healthy diet. Cut down on red meat, for instance, cut down on fatty foods. For people who are still smoking, they have to stop smoking. Those taking excessive alcohol, they have to cut down on that, and then avoid sedentary lifestyle, meaning make sure you are very active, make sure you are not sluggish. This concept of sitting down, holding a remote control, eating, and then sleeping on the same sofa is not a healthy habit. Thank you.
Thank you so much, Doctor, for sharing your thoughts with us. We hope when we call you next time, you'll do us well to come again and explain some more about stroke.
Thank you for having me.
And my guest has been Dr. Kanu Alfred, who is a consultant neurologist, Federal Teaching Hospital, Gombe. He has been my guest on the show. I remain Shade Salau. We shall come your way same time next week, God willing. From me and all of us from the studio, NTA Gombe studio, is bye for now.